So, good evening, everyone, on this amazing Tuesday as we enter into the holidays. Back by popular demand, we have Miss Maureen Leister joining us again for our second, and this will conclude short term anyway, as we enter into the holidays, our mental health talk. But I said by demand because last time we went over several things. We talked about depression, anxiety, being on the spectrum. And tonight we want to go a little bit deeper and talk about the things that normally people don't talk about, hence their mental health taboo. So I don't want to take up too much of the time because I know we're excited to get started and talk about so many things. But I do want to acknowledge, in addition to Maureen, we have Miss Lynetta Daniels joining us, and we also have Mr. Derek Thompson joining us. So this is going to be a great talk. About mental health. We ask you to chime in the chat if you have questions, comments, thoughts, but we want to spend the bulk of the time hopefully giving you some additional tools and practices, best practices that'll get you through the holiday. I posted on social media that the holidays can be somewhat saddening. And then I also said sometimes it's even more saddening when you think of just life in general, or the weather and wherever you reside is just sometimes dark and gloomy, and sometimes it's difficult to bounce back. For all of these reasons and more, we thought it was pertinent to have another conversation about mental health and wellness. So I'll get started, and feel free as we go around with the those on the call to talk about anything that is on your heart, or if you want to share a little bit more about yourselves. So for me, I wanted to get started because I felt like the last time, you know, we talk about mental health, and it seems today like it's it's normal, right? More people have therapists or seek additional outside help. But I thought it was interesting growing up because for me personally, like, I mean, if you had an issue, you would not come in and say, well, I need to speak to a therapist. I want to go talk to someone. Basically, you want to go pray about it because that's the culture in which I reside. You can pray about it. I don't know if I knew of anyone talking to a therapist. If they were, they didn't publicly admit it. But it was more of prayer and get yourself together, right? Because there could be consequences. But it wasn't talk about wellness and, hey, how are you feeling? And even as a child or a young adult. So I think that in itself is taboo. And I won't speak for all African Americans, but I can just speak from my immediate family. It was not something that was talked about in terms of mental health or how are you doing in general in terms of overall wellness. Would you all agree? And did you see at some point, I don't know, a tide turned and it became more safe and more common to have conversations about your mental health and wellness?
Hey, Adrian, this is Derek. So one thing I recognized was during the pandemic opened up a door for people to really kind of
Mhm.
express, what they needed as far as
Mhm.
that mental health piece. I mean, it opened up a door for people to be comfortable to talk about it, to kind of recognize the threat. So while, we look at the pandemic as a bad thing, it did open that up. Now, people are really exploring this piece a lot more and recognizing some of the dangers that we deal with just in our everyday environment. For myself, my story, I remember being in the military and just going overseas to war zones and coming back. And, back in the 90s when we were doing that, you come back from a war zone, everybody tell you, okay, keep pressing forward. But as I look back and we start exploring more, realize that, man, there were some things that need to be dealt with, from the dangers of just, seeing people, kind of go through explosions or, the things that we
Mhm.
deal with every day. So it's really needed. And while I would come back and, a car would backfire, I would jump, right? To me, it was just nothing
Mhm.
because I was so trained and programmed to just be able to keep going and keep moving. But as I started like looking into it and started understanding more, I'm like, wow, I really needed some help during those time frames.
Mhm. Yeah.
So this is Lynetta Adrian. I would say this as well. One, I'm gonna say 2 points here. One with COVID, and I agree with Derek. With COVID, it kind of gave us the okay to be not okay, but you had the data to back it up. So the data was undeniable when you started having a lot of physical abuse, domestic violence, suicides,
Mhm.
or attempted suicide. So the data was there to back up that there was some help needed. So it was
Mhm.
undeniable that it was needed. But then the other thing is, as a culture, the Black culture, we don't have the time to sit back and cry over our spilt milk, so to say. We have to keep pressing forward. So we never got that permission to not be okay, and to take the time to not be okay. And hey, it's okay if you're not okay. We never got that, because oftentimes it's like, you got to get the kids off, you got to go to work, you got to do this. And then if you're one doing it by yourself, you don't have that relief to give you that space to do it. And we don't get that same recognition as this problem is the same problem for this little African American girl as it is the same problem for Susie, Caucasian girl. And it's not a behavior problem for one, and a mental problem for the other. So there's that difference in how it's even accepted sometimes as well.
Well, I will tell you that when I came into this field, and I told my dad, I'd been in the military 10 years, got out, and I said, I'm going to go to Syracuse, Dad. I'm going to become a psychotherapist. And he was like, what? you mean a physical therapist? And I'm like, no, Dad, a psychotherapist. Why would you do that, Maureen? What would possess you to think like that? I'm like, Dad, I really want to do this. And I must say, my dad, every time I would learn something, I could sit down and talk to him about it. And he began to relate it to his long time in the military. He'd been in 27 years. And, and seeing what he had gone through, and then what I would do to, what you would do in my field to make some changes there. And so we all have something. And I think in general, the only way that I saw as a child that it was acceptable for anybody to go was, you heard the movie stars went, and you heard that, only crazy people went. Everybody had to be crazy. Right. And I must say, when I first started in this field, it was the same way. First thing is, I'm not crazy, but I got this problem. And so when we're looking about, where and what culturally where we're at, I still see a lot of reticence in particular groups of people. Not so much African Americans. In fact, I would say that's about half of my clientele right now. But I would say it is still very difficult for people with certain religious backgrounds, people that are coming from places like India or Pakistan. So people with strong cultural pieces of, this is the way we do things. And if you step outside of it, regardless of whether you're down here socioeconomically or you're up here, you just don't do that. And I mean, I now am doing strictly telehealth, but when I was working out of my office, I can remember one person in particular where she was terrified that somebody would see her coming in. And so she would go out, and we had a cluster of little buildings, and be walking around one of the other buildings. And when it was her turn to come in, I would have to let her in through the back door.
Oh, wow.
And it was because she didn't want to get seen, not just paranoia in general, but because of the backlash. It had something to do with people she was connected to politically, and, don't put it out there. And but that was it. Very different. Very different. The pandemic kind of brought things to a head, because for the longest time, dealing with people that had been in abusive relationships was, our job is to get them out of there, not necessarily to help them function, either the perpetrator or the victim, and learn how to break out of that pattern.
Right.
I mean, that has taken quite a bit before we finally realize it's not just about, putting somebody in jail or giving them a roof over their head. They need more, and they need to understand how to break out of this cycle. And, that is so interesting as people begin to realize and look back on how we raised. Where did you come from? What's your background? How did you step outside that so that mental health, seeing a therapist would be okay? And, doctors for the longest time, they'd go see a psychiatrist, get medicine, but it took quite a while before even the psychiatrists were sending people to therapists. And
Right.
like, you think it's just medicine that's going to push the button?
Right.
They've got these issues for a reason. Let's work through. I work with a lot of vets, and and I have a lot of people that are like, we just couldn't talk about it. Where were we going to go? And then
Yeah.
you add things like culture, race, being a person, being somebody with
Clearance,
rank.
job
You
clearances.
could see it.
Yeah.
Very, yes. And so why would I say anything? And you're about ready to,
Mm.
and it was, some of that continues to be mirrored, but I'm really surprised that I'm finding more and more people that with their age kind of learning over the past 20 years that, maybe dealing with mental health issues are okay, that I'm getting people in that are like, doctors. Normally a
Yeah.
doctor would not see a therapist unless it was like their buddy down the hall. But
Right.
in this case, they have the same issues as everybody else. Do they not, have arguments with their wife and can't figure out what to do? Or
Mhm.
they're struggling because they're dealing with some experiences with their families and things, or even they have anxiety or depression or whatever, and they want to work on it. They know it's deeper than just this, and it's suddenly becoming acceptable. People are
So,
coming in and it's like, wow.
what are some for those that are listening and watching tonight? One, we're grateful and thankful to have you. What are some of the more common things, Maureen, that you see people coming to you to try to deal with that they feel like they can't handle? Because I'm thinking there might be people on this call or joining in trying to also figure out, yeah, hey, I'm dealing with those things too. I didn't know people actually sought help for these types of things.
Well, just like what Derek was talking about, you're hitting the deck when you hear a backfire on a car. You didn't
Mhm.
realize what was going on, and then maybe you start having bad dreams or something. It doesn't have to be though from a war zone.
Mhm.
Post-traumatic stress comes from something traumatic, and also for a long time, people thought that was just if I experienced it. If I was in the car accident, okay, maybe I had post-traumatic stress, but maybe I was on the corner and I saw the car impact you.
Mm.
That creates
Mhm.
trauma for me too. So learning that those things can also be dealt with. Um, losing a spouse, losing a child, having a tremendous amount of anxiety and having panic attacks all the time.
Mhm.
I will be grateful for the day when I finally stop hearing, that's just the way I am.
Right.
I just
Mhm.
panic all the time. What's the big deal? I can't sleep. I can't eat. I don't feel good. Well, would you like to see a therapist? I don't need that.
Right.
It's like, okay,
Exactly.
But you know what?
we're not going
What
to
I
change.
found difficult for me with my daughters, my oldest daughter, she has anxiety, she has, some other things going on, but um recognizing the signs distinct and separate from other signs. So for me, I think hers coincided with the change into young ladyhood.
Mhm.
So for
Mm-hmm.
me, it was, is it that time of the month, or you just having a bad day? So it wasn't very clear to me for a long time what this behavior was. Where was it coming from? Because I was, look,
Mm-hmm.
get it together, girl. You have to, go get you something, because I didn't see it. And by the time it really hit me and it was clear, it was in a traumatic situation where it was life or death. I didn't get it. And I had a pause. I told her, I said, I didn't get it because I never had that opportunity to be in my feelings. So I didn't understand that someone was in their feelings,
Mm-hmm.
because how do you take that time? Who has that time to take? So for us, for me, I would say education and the warning signs, because they're not all the same. So missing some things, and unfortunately, I used to call her Katie Kaboom, because I'm like, oh Lord, she's Katie this, right now, because the next
Right.
7 days I got to deal with this change in attitude. When really, what it was, an onset of all these things, and it just happened to coincide with her life change.
You know
One
that.
thing
Mm-hmm.
one thing I wanted to add with that is like, and I like what Dr. Leister said. And one thing that hit me, I used to work with Credo, which is kind of like one of those things that were kind of set for when military came back to transition to a normal world. And one of the things that Chaplain said was no thing too small. And in this retreat that we was on, it actually hit us with actual guy saying that he actually lost his grandmother, and it was nothing, right? But he said a couple of weeks later his cat died and everything spilled out because he never dealt with it. And I think that's the mindset that
Mm-hmm.
we need to take with
Mhm.
like the society, is that listen, anything that you deal with is still worth like looking into to figure out where you are. Because the biggest thing that we catch, if we don't catch it too late, then it ends up being a problem where when I'm talking to you, now I'm working through some greater things. And so we
Mhm.
had started with some of the brothers we talked to was, hey, listen, guys, just let's not take for granted anything, because
Mhm.
Mhm.
that's what we've been doing for so long. Is that everything that was the mentality? Oh, I'm a man. Nothing hurts me. I just got to keep pressing. I got to keep going.
Mhm.
But now, by the time you get older, now these mental issues have now become part of our health issues, and it goes to a point to where I'm having physical ailments. And I've seen people that actually had these things where they're in the hospital because they have heart attacks, or they have these because that pressure has gotten so great. So I think
Mm-hmm.
it's just something that we gotta, like, in our society, as we have these talks, nothing too small, or anything that we deal with, let's look into it and see where we really are with it, even if we think it's nothing.
Mhm.
Yeah, I love that '09 Learning made a comment that, yeah, agree, in the African American community, you didn't hear of anyone going to counseling. You really didn't. I mean,
Mhm.
prayer was that divine intervention. And I love what Chris shared too as a nurse. And this is going to segue. Thank you for this comment, Chris. Self-disclosing with her patients about mental health issues made them more comfortable with safely asking for help. But it's so funny
Mhm.
because I don't know if it's a strength or if it's a negative thing. But Darius and Lynetta and Maureen, we've talked about this too. Laugh because one of my gifts. So I think my superwoman powers, because we're gonna get this is a
Compartmentalization.
taboo talk, is I am a compartmentalizer. I
So am
will.
I.
I will compartmentalize next. And Lonetta's like, well, you can talk about it. And Derek's like, I think you might want to you want to talk. And are you good? Are you good? Because I am so quick to turn the page on, like, the superpower, just like you said, on that. I've got 99 real air quote
Mhm.
problems, don't have time. And so in order to get through that is put that in a bucket. Now, my mom does say, like, well, so I love the 24-year-old daughter I have, because this is a new generation. She was like, and so do you think that's healthy? Because it sounds triggering. Um, so,
Good for
and
her.
boundaries is one thing, but I always thought I'm the queen of compartmentalization. And people go, who knew you were going through that? You wouldn't know, because I would
Mhm.
never say it, being guarded. And so I wonder, people, and this is what I'm learning, as you get older, you're thinking like, well, is that really good? Is it so safe? Even, in my friendships, people used to say, well, you can talk to me. And I was like, no, I'm great.
Mhm.
Next. And
Same
if
way.
there was a tear to be shed, it's rarely shed. And if it is, it's in the
Is in the
shower where it
shower.
blends in with the water and nobody knows about it. But
No,
otherwise,
exactly.
yeah, someone's like, you can cry. And I'm like, oh, I'm not going to cry. I'm quick to say, I'm not crying about that. But
Mhm.
inside, maybe you do need to cry. And maybe you do. I was with 4 people, and 3 of them had therapists. And they were asking me, what's wrong with me? Like, why didn't I have one? And I was like, I don't know why you all had three
It's a
out of four. The one guy said 3 out of 4, 75% of the people here talk to someone, but you don't. You think you're the oddity. So I want people listening tonight to think that it's okay. And I'm starting to be more acceptance. And I talk to Maureen, it goes into hours and it turns into a session because she's so good. But I think I probably could use it more than I realized, just culturally. And then that superwoman mentality of like, yeah, I'll recommend it for you, but I'm good.
Yeah, my
But
daughter
don't
told
you
me the
get?
same thing, that I need to see a
You know
therapist.
what
She said, Mom,
often
I think you have
happens
childhood trauma.
Now I was gonna say, don't you think,
when you
like, and
see
this is
what
for
what
Doc.
Derek
This
was talking about.
No, go ahead, Dr.
No,
Leister. I'll
I
let
was
you
just
finish.
mentioning, Derek, what you were talking about, how you were talking to somebody that lost their grandma and thought they were past it, and then the cat dies. It's the same thing. When you compartmentalize, eventually that box gets way too full.
Mhm.
And it all takes is one little piece. And suddenly I'm getting a call like, I'm crying everywhere I go. I don't know what's going on, what's happening. And it's because you have reached that point. And a lot of times, the little thing that pushes you over is like, I've handled this a dozen times. But your brain is going like, not today. We're full. So, okay.
I think that's the
We can
scary
talk.
part about being human, right? Is like you don't really know yourself, but we think we do. And we don't understand how the environment within itself stimulates us, right? All these stressors that we deal with on a daily basis. I mean, from, like every day you can be like in Chicago, seeing people get shot. Oh, it's just part of my everyday life. But then when it hits you, it really hits you. And I think that's the thing where, like, and this is for this is Dr. Leister's question. We should probably say, you know what, even though I think I don't need it, maybe it's good to just go and say, hey, let's have a conversation. Let's talk to someone that can actually kind of walk through these things, because just because of what we deal with, think about it, every day people struggle with financial. We're in Christmas season, right? People are spending money. They're being manipulated through advertisement. They're being manipulated through movies. Some people watch scary movies and they have to deal with trauma through that. So it's so many different things that we look at, we laugh at it, right? But think about how many people say, I can't even cut the light off at night or something, whatever, because I've been watching a scary movie. That's stuff that we have to deal with on a daily basis, that we gotta like understand that, man, the environment could be continually hostile against us in every area we turn around and look at,
Yeah.
We have, how the brain works is, and we had mentioned this a little bit the last session, how we connect things together. We store things by like emotion or like situation. And so it's like that. If you haven't worked on it, you can go all the way back to what you did back when you were in high school, when you got humiliated, when you went up to the board and you couldn't pronounce something. And here you are going, it's 20 years later. Why is that still bothering me? And it's because you didn't resolve it. You just left it as a really painful piece in your life. And all the other little painful pieces are all lining up right there. And then you get an emotional overload. And when you get the emotional overload, then you find out for sure, I got to deal with this. Or else you go, I am losing my mind. What is wrong with me? And you try different things. Why do so many people first thing when they start feeling stressed, I'll just get a drink, I'll just smoke, variety of things. But they're thinking this is going to take care of it. No, it doesn't. What it does is it really just kind of works on depressing your system and confusing your senses. It's still there. It's just now it's not up in the front of my brain anymore because my brain can't hold it there right now. So what do? You drink or you smoke more, or, it's like vicious cycle. It doesn't go away until you deal with it. Yeah. So even when you're really, really good, some people can suppress really stressful things, but they pop up, and they usually pop up at really inopportune times. So, for instance, if somebody was molested back when they were in high school, and you're like, well, I'm way out of high school, I should be fine. And then their daughter has a baby, and they see that baby, and then they think of their daughter in a different way, and bam, it suddenly is coming back. I didn't get protected like this child is. I'm fearful for what would happen to them. Everything starts rolling out the door. And that's when people are like, I am losing my ever-loving mind. So, feeling free to talk to people. And for Pete's sakes, please choose a therapist, someone with some training, someone with some background, other than somebody that tells you, I know how to handle this. You got it. Because that's the follow-up piece, is you would get sent to a friend or a friend of a friend, and they would tell you, you're fine. You're fine. You're all right now. Yep. I will tell you that the number one place that a lot of this built-up anxiety comes out the first time is in the shower. And it's because usually you're so relaxed, you're not suppressing anything. You're just like, oh, this feels good. And then all of a sudden it's like, what is
Yeah.
that? You feel the panicky feeling coming. And then it's like, oh my gosh, what's happening? Is somebody breaking my house? What is something going on? Who's out there? And you create the whole scenario at that point, and you're having a panic attack. All I did was take the shower. What happened?
Right.
So they come out in weird ways. Letting people talk things through. Christmas time, holidays, where people have especially major losses of family members.
Yeah.
Um, and for anybody that is struggling with having a loss, it is difficult to get through the next season and focus on it until you kind of deal with the loss of the person. And then you're going to carry it around the rest of your life if it's somebody really significant to you, a parent, a good friend. Um, and when you get to the point where you can think about the positive things about that person and how much you enjoyed what you did, um, that's the part. I mean, I sent um, a TikTok that had all these pictures of things that happened growing up, and I'm like, oh my gosh, that was just like my family. So I sent it to my sisters, and it
Mm-hmm.
was like, oh my gosh, remember this? Everybody getting their pajamas in their pajamas for the picture, and or
Oh,
having the
that's a
fake
good.
Santa Claus stuff, or all those different things, and they were positive memories, and we didn't have to immediately attach it to the loss of my parents, but bringing back the positive piece that was with my parents when they were there, when we were there, we were little kids. They were,
Yeah.
taking care of us.
That that
So
that that's a skill though, isn't it? Because I've been listening to what ER Tech 2M said. Sometimes driving by, just being by yourself, or driving, or any time by yourself could be a lonely. How do you pivot to try to focus on those happier things? I get the pictures idea, and that's good. But if you're just driving, or like if I'm listening to a gospel song or something, it can invoke something that's somewhat sad. How do you mentally teach yourself to course correct when those sad things come into your mind?
the recognition of the fact that this is sad, and right now I don't have the time to deal with this. If I am driving down the highway, I do not want to be boo-hooing and beating myself up. I need to be, paying attention and feeling kind of upbeat. And
Mhm.
so frequently it's like, um, you know, dealing with shifting your thought process, shifting the music. Not all
Mhm.
gospel music is going to be uplifting, you know. Um, Sometimes I have people call friends, call family, and just start talking. How are you? What's going on? This is where I am, and I'm staring over the wasteland, driving for, you know, the past 100 miles as flat as a pancake. But you're redirecting your thought process. That's not the time to process all your heavy duty stuff,
Mhm.
because you should be focusing primarily on driving. So,
Yeah.
choose the time and place. Keep your anxiety down by also talking yourself through it.
Yeah.
So it
And
seems Chris came up with
mind and
something in the
body.
chat, looks like.
Yeah, mind and body are equally important, is what Chris Burris said. Felicia, she agrees that sometimes driving and having that alone time, can cause people to kind of think some things sometimes that may not always be as positive. Um, kind of can
But
relate to
also too,
that.
one thing I found out, and this is from an experience, just to be a little transparent, was so when my first child was born, I was actually overseas. So she was, gonna be born a couple months later. But I was on a mission where we were doing like human trafficking, and we had to pull like dead bodies out of water of young girls that were, pretty much kidnapped and thrown over the side. And so
Mhm.
that whole time when I got back, it was very difficult to like let her go anywhere. It's like, when you take her to daycare, I'll just stay at home, like I'm going to work. And so I didn't know what I was dealing with. But what I did was I had to just face the reality that I got to take her, and I had to kind of trust the process of just taking her and trusting that she'll be there when I get back. You know, it was difficult. And I have found out that it was easier when I just, okay, the first time I got to do it, I just got to know that, hey, things are in place to do it. I was come by there and check as much as I could, but eventually it got easier. So everything, I mean, I think I'm definitely not an expert, so don't say I'm giving as an expert. But one thing that I've done with is that I have to face the actual situation. I have to face it for what it really is to be able to, kind of get over it. That was the thing. And then having professional help, because it needed that, and talking to people to say, hey, it's going to be okay. We got things in place. We're here. Hey, look, what I do, how can I know my child is safe? Asking those questions and being able to deal with those helped me in a lot of situations, because at first it was like I couldn't even go to work. I was like, nah, man, my child is, I don't know what's gonna happen, so I'm not gonna take it. I'll just stay at home today. So it was tough. So.
Yeah. Yeah. And I
Yeah,
think it's
for sure.
important too. Go ahead, Dr. Maureen.
No, I was just saying, I see a lot of people where the transference comes across. So if you go home and you talk to your wife and you tell her why you're frightened for your child, now
Yeah.
she wasn't thinking about it before, but now
Yeah,
she's
now.
frightened too.
Right.
Yep.
And I've had people that couldn't leave the house. It started off with one person coming home from a situation like what you experienced, and then it moves to the wife, because of course I love my kids too. Oh my gosh, I didn't even think about that before. Now she's panicky, and then
Hmm.
having kids that were um, there was like a 7 and a 10-year-old. The 10-year-old became frightened. She heard the
Yeah.
parents talking, and she
Yep.
freaked out when the 7-year-old went outside to play. And
Yeah.
it was like, oh my goodness.
Yeah.
One of the things that comes up with PTSD that we're realizing is that you can influence your your family, the people you're with all the time, to have
Hmm.
Wow.
some of the same um, anxiety.
Symptoms.
So
Yeah. Wow.
you're the one that experienced it, but they're vicariously living what you're emoting, and it just kind of goes down the line. So that's very difficult to break unless you've got somebody that you're working with, a therapist in that situation. You know,
Yeah. I
That's an
want to
epiphany,
pull.
what
doctor.
you did was
That's an epiphany.
desensitization.
Yeah.
It's
Yeah. That was an epiphany right
oh
there. Yeah, I
good.
never thought of it that way. It's serious, just like a paradigm shift or something. Wow. I mean, wow.
Yeah. And I want to pull the thread on that 10-year-old because, well, I just recently won the Eagles Organization Women of the Year. And so it's an organization that's heavily in the mentoring space, big on mentoring at all levels, right? Middle school, high school, college, and even adults mentoring each other. And then also with the Carolyn A. Parker Foundation, we do a lot of mentoring with middle school girls and women to women. But children, what are some, Lynetta kind of alluded to it. They're going to be sad children around the holidays. It impacts, we said, the family dynamic. How are we coaching or recognizing things? Like, what are we telling children or parents of children to give them tools to help the children, I guess, cope before it gets to that maturation or that maturity state of being more problematic, turning to things like drug or alcohol or just, socially isolating. I talked to a young girl recently about cutting. I can't honestly say I still fully understand it. I don't know if parents get together and support each other in that space. But one, no, you're not alone. More girls, I think, are doing it than people think. But how do we help them before they get to the point of masking their pain by allowing pain to be experienced in another space? I still struggle even after spending time with an older person, not older, but definitely 18, but she had a history of doing it and she felt validated and still justified doing it. Like, how do we help the youth before they get to be adults like us, or even myself, compartmentalizing, deflecting, not dealing with it until you reach your tipping point?
Sometimes you can't, because you're the parent and they see you in a certain way.
Mm,
Sometimes it has to be by somebody outside you, because what do they usually do? They hide it. You know,
yes.
they're going through things, and you're seeing things on the outside, like Lynette was talking about, where you know something's going on, but you're trying to make sense of it, and your mind doesn't immediately go to, oh, they're cutting. your mind is like, oh, it must be their period. And we know how that goes. That
Right.
really changes mood, attitude,
Or you didn't
everything.
get invited to the party, or there's a
Yeah.
post on you on social media that isn't nice, and you don't want to tell your parents because it's not nice. Yeah.
Being able to increase that dialogue instead of threatening your kids, but and I say threatening because a lot of people are like, I want to let them know where the boundaries are. I will tear you up if you do X, Y, Z. They can
Mm-hmm.
learn. They just go underground. They're not going to tell.
Yeah.
But start having those discussions when your kids are young. What can you tell me? And what's going on? Oh, what do you think about that? How does that go? So that your children feel heard, and they feel that it's okay that they have these feelings, and they're not always going to be how you experience things. Because the other thing I get frequently is parents that think their children think like them. No, they
Mm-hmm.
don't. They certainly don't. Your 6-year-old is not out thinking, I can't believe this, my parents are doing to me. No, they're much more concrete. It's up front, it's right there. Usually you can have pretty good conversations with them, but
Mm-hmm.
they know what it's like, and they know to shut up and not say anything if you scream, holler, and threaten. That's not the
Mm-hmm.
same thing as setting a boundary. When you set a boundary, your child knows what limit got crossed, and you got to follow through with the consequence. But the consequence is not going to take, like you'll never have your cell phone for a year. Not realistic. It's like you've got to be able to work out, how can I dialogue with my child? Does my child know what the limits are? Do they know I love them? Do they know I just want them to know that if they're worried about their friends, that they can come and tell me about that, and we can talk through what we can do. 2 of my children unfortunately took it way too much to heart and kept trying to drag them home for me to do therapy with.
Right.
So we had a little discussion around that too. But you want to have your child, even if they feel they can't go to you, to maybe go to a trusted friend's parent. And even though we're like, oh, they couldn't talk to me.
Yes. Yeah, your question, you'll need therapy after hearing that, because you start to wonder why. And when you can't receive, or you're not ready to receive some of what they're saying, then how do you process that?
And it could be any reason. We've got to stop taking it really personally and just go, okay, the main point is, I know now I'm going to work with this.
Yeah.
How we got there a lot of times is maybe your child was looking at you and you're upset because you're going through a divorce, and they're like, I don't want to tell mom. She's got enough to worry about. This,
Mm-hmm.
I'll tell so and so. Okay, as long as we get to it. Um,
Yeah.
Again, they're going to think like the child. They're not going to think like the adult, which is, this is serious enough. Come to me, talk to me. Let's see what
Mm-hmm.
we can do. So learning how to encouraging our kids to talk about hard subjects. I have parents that are sweating bullets because their kids are starting in sex ed, and the child wants to come home and say, hey, guess what I learned? And the parents are like terrified. No, and it's going. This is the time where you can at least go, wow. So what did you think? Even if you can't
Mm-hmm.
figure out where we go from here, try to let them express what's going
Yeah.
on, and at the same time, fix anything that's inappropriate. They got the wrong message, but just be like, well, I don't think that's quite how it goes. Maybe you should bring that up in class and encourage them to do stuff. Because it's only going to be a year or two before they are really reluctant to talk to you about something like that.
Yeah, this is such a reflective time of year too. You've got New Year resolutions, right? Everybody, not everybody, but many of us want something reset in our life, whether it's your professional life, your relationships, your spiritual, your health and wellness, mentally and physically. Um, how do we go about doing that so we set ourselves up for success? And I think a lot of times it is that extra help when you fall short of it, not to beat yourself up. I call it having an accountability partner. But like you said, you really want a professional sometimes, because we have people in our circles that'll validate what you're feeling because they don't want to hurt your feelings, right?
Exactly.
And it doesn't help you much. But then you have those that, they'll have a crucial conversation very lovingly. But then you have that outsider. I am not a big disclosure, vulnerable. So I'm growing at doing that much better because I think it helps other people. Then it also helps you. But I know sometimes, you know, a lot of people don't want to disclose what they're going through as they're going into the new year. And you feel like,
Mhm.
I guess I want people to be able to shed some of this baggage and have a happier holiday experience than taking it in. But then it's like, well, what tools do I give you to do that?
Mhm.
Mhm. One of the first things is, again, don't stuff it. Don't drink. Don't sit there and get all smoked up. So it's like I just won't deal with the stress. Actually, sit down and have some thoughts about where your goal is. What do I want to shoot for? And then try to figure out what steps am I going to take. And it's not all at one time. There's
Yes.
no way. You've got, when I teach people how to deal with their anxiety and not to keep rolling with panic attacks, we learn one skill at a time, and
Mm-hmm.
it's cumulative. So we spend, first session on this, second session on this, but then that we talk about the first one, and then, so that you're building
Mm-hmm.
these pieces. That's the same way you go towards your goals. If I have somebody that wants to go get a master's degree in something, that's great, but it may feel overwhelming. So we start narrowing down the topic. What do you want to get
Right.
the master's degree in? And, how do you feel about that? Why did you choose that one? I mean,
Mm-hmm.
it's not for me, but you have to make sure what fits for you. All right, now
Mm-hmm.
what do we need to do? And frequently we have to sit down and talk about breaking it into steps. And sometimes it seems pretty silly, but it's like, well, do you want to stay in the local area? Do you mind
Mm-hmm.
traveling? Do you want to, where do you want to be? What size school do you want to go to? All right, now out of those little groups, now we know kind of what you want to do, what kind of degree you want, and we know the general area you want to be in. Now let's go out and start looking at what those schools have to offer so that you begin to narrow it down, and
Mm-hmm.
it's easier to do. And you're not going to do it all in
Smaller
one day.
chunks. Yeah, smaller chunks.
That's
Lynetta
it.
and I, we recently participated in a vision board exercise. I'm a believer in vision boards, and I used to host them for women. We get together and have a vision board party, and it was for multiple reasons. It was to identify where you want to go, like you said, Maureen, and then more importantly, what actionable steps you're going to take to get the outcome you want. But then it was to create an infrastructure that was supportive, right? So if I was falling short, I could call up Maureen, or I could say, yeah, or Lynetta could call me and say, hey, aren't you supposed to be around the first quarter doing X, Y, and Z? And it's kind of like, well, I didn't really, I got this going on, and then this is going on, and then that's going on, and kids, family, professional set, whatever the issue is. But someone that builds you back up. I think that's
Mhm.
important too. I call it your little tribe, to have some sort of tribe. I don't know anyone that gets to where they want to be alone, or any aspect, whether it's education. We all have had people help us open doors, talk us through, talk us off the ledge. I'm a believer in mentoring. I'm a benefactor of the power of mentorship. And it to me has probably filled a void where I could and should have talked to a professional, and still will talk to a professional. The more I get, the more I like the idea. But I always just relied on mentors to help me, but they're not professionals, right? And I authored a book about it because I'm so passionate about the power of mentorship. And it has saved me in so many areas. But I think it's important for people to know that if you don't get help, you don't feel you're ready to make that professional leap, that you still find a tribe of trusted people that hold you accountable um, for your actions
Yeah.
and how you treat other people. And I think that's important in terms of mentoring, to get people to see, yeah, that it's okay to seek professional help, but even when you can't get to that professional therapist because of scheduling or constraints, that you don't fall off, right? You still have an infrastructure of trusted agents to kind of carry you through. And those relationships are few and far in between, too. I recognize that. But you have one good tribe of people. Derek's is good about calling and saying, "Are you good?" It'll just be random. Haven't heard from you. How are things going? And you're like, "Are you getting any rest?" Things like that, because that's an area. And it's like, Derek, I just went from San Diego to Texas in like 24 hours. It's just like I rest on the
Hey,
plane.
Hey, Adrian, just to add on to that, right? I'm sorry, I had to cut my camera off for connectivity issue because I'm out of my car.
Uh-huh.
But I wanted to say that that vision statement is one thing that I've got from that. It offers anchor points, right? And one of the things that you need, and a lot of time when you unravel, is because you don't have those anchor points to where direction, things that I'm dealing with. It kind of really kind of centered me. So one of my strengths was what helped me through all the stuff that I dealt with was having those places where, okay, I have a place where I got to go. So I deal with the things by having a vision on how I'm going to deal with it. And that does talk with somebody that has been there already. I do have the therapist that I say, hey, look, what do you think about this? And those anchor points help you kind of stay aligned in those tough periods. Have something to hang on to. And it's, for me, it's been very helpful to be able to do that. So the vision statement every year, I think when we talk about it, it's something that I need, because if I don't have that, I lose
Mm-hmm.
direction. The next thing you know, all these things kind of spiral out of control because I don't have that point to be able to say, okay, let me hang on to this. Just know where I'm going to in the midst of this problem or situation. So it's been very
Yeah.
Mhm.
critical for me for my success and just being able to deal with the traumas of life. Dun, dun, dun.
Yeah, and I tell people this is the lonely work, right? It's the only you can do it. That's why I call it lonely work. I mean, it's only you that can be reflective and try to figure out what those anchors should be. Um, at that phase of life, it's not something that someone else can do for you. And that's important kind of to note too, that, sometimes we do have to spend a little bit of time doing that lonely work by ourselves to figure it out. But I always said that I always felt like there was someone less fortunate than me. And if I stacked my problems in a pile of others, I
Mhm.
probably want mine back. Um, so,
Maybe,
so
maybe.
maybe, right? Right? Because there's always a better case than you, and there's always a worse case, I always felt, right? But so for me, it was an opportunity to, this holiday, giving back and, focusing on helping other people with some of the challenges that they're going through. Some may say it's a little bit deflective, but it always allowed me to be even more appreciative for my situation, because there's always someone there's always an opportunity that your situation could be worse. And so
Mhm.
by helping other people, kind of, whether giving back in some way, even if you don't have much to give, time is a resource too. It always helped me to not be so down when I was down, because you start looking in your health and you just find rewards in giving back. And more importantly, whether it's, mentoring, community service, rolling up your sleeves, helping with the home, whatever it is, whatever you like to do, it always helped me get out of my own headspace sometimes. And that can change things around during the holiday season as well.
AJ, you bring up another, you kind of brought up another good point that I like to think about when I'm like talking is we can never like downplay like how bad like a small situation could be to somebody. And I think that's one of the
Hmm.
things that like as we had even started the conversation was the biggest killer, because it may be something that we think is simple, like uh man, that person said something out of line. I remember on a deployment one time, a guy, they got into an argument, and the guy, called his wife a bad name. He just bust out in tears. And like, back and now thing is like, the word is, so why you acting like that? It's no big deal. But it really, really hurt my buddy, and like it made me
Hmm.
realize that man, you have to like take everything that happens, you can't never take it for granted and say, oh, you should be okay, you should be that. But that can easily spiral someone in that case. So like for everybody on the line, I think that's one thing we look at, like the smallest situation, to always look at it and say, you know what, I don't want to like, look at it from how I feel about it, but like understanding what someone else. It's easy for us to kind of always want to say, well, for me, it was no big deal. Why are you tripping over that? But I need to always think, you know what about the other person? Like, how does that affect them? What is that really doing to them? Those are the mindsets that we need in our society now to really, like, it will prompt us to say, hey, go get the help. It will prompt us to say, hey, look, I'm not going to leave you until something happens. Just like with the drunk driver thing, we can easily identify the guy that, we're not going to let drive home with the keys, but we need to also look at it to the person that, hey, man, just saying, you know what, I'm hurting, but by expression of a cry or some word that comes out where, that really kind of affected me. But, you don't say it to the point to where you see tears, but that something was said. So we need that in our society, especially during this time frame. Like, I don't understand how all the pressure comes, but you see it, right? You see the pressure on people. You see the mindsets. You see kind of like, you hear the numbers, right, of suicides and people, checking themselves in, that we need to, like, really kind of take that on board as we move forward.
Most of us get very judgmental. And just because I could do it, and it's a lot of time a way that we boost our own ego, but you have no idea what's going on for other people in that situation. Uh-oh. We're talking at the same time.
No, I'm learning. I'm listening.
I can't.
We can't hear her. She's talking, but we can't hear her.
Yeah, I can't. I see her moving. All right. Well, see if you can get her. It does, when somebody comes into a therapist, it's not going to be about judgment, whatever the issue is. It's more like, let's just figure out what it is and what we've got to work through. And when we're supporting other people, we need to do the same thing. We make a lot of presumptions about what they're going through, how they feel, what's happening for them. But we really need to let them tell us. And, and if they're telling us they're full up and, they're on their last nerve, you don't sit there and argue with them. Or they're feeling pain. No. How do I know? You've got to go with what you're hearing, what you're seeing, what they're experiencing. And, the first thing you do is not to tell them what's wrong with them. The first thing you do is you sit down, and when I have new people come in, I do an assessment and we go over all kinds of things about them. And you just let the material come to the surface by itself, and it will. And then we figure out how we're going to handle it and what's going to come next. And see, again, we take it in sound bites. Mostly people want to be heard. That doesn't mean ad nauseum, but I just need somebody to validate how I feel. That's a number one thing, especially between parents and their children. It's not so much to validate us as parents as the fact that our kids need to be validated, that we do hear them. Uh-oh, there's another one. Can't hear. What happened?
We can hear you, we just can't hear Adrian.
Oh, somebody else just popped up and said they couldn't hear either. Huh.
I think they said they couldn't hear her. Make sure.
Okay. Well, when you're dealing with things around the holidays, you ask other people how they feel and how, or what can I do, or invite them to join you. Be the positive distraction. Don't be the judgmental person. You should be over that by now. I had somebody come in one time and they're like, oh, they're telling me I have to be over this. My family and friends said I got to be over this. It was the death of their husband. And I'm thinking, oh my gosh, this must be dragging on forever. And when I actually talked to them and finally got around to the point about, okay, so I'm so sorry, but when did your husband die? It was 2 weeks ago. And I'm like, all right, where are those people? I want to talk to them. You don't just pop back after unexpected death of somebody that you love, and nobody can put a timer on it, So listening to people, letting people talk, hearing them. Do not go down the negative pathway with people that everything is bad, horrible, awful. Ask them what they feel and what they think. But if it's just repeat, then try to be like, okay, so let's go a different path. Let's try to get things going in a positive way.
Mm-hmm.
So, Lynetta, how did you finally connect with your daughter?
Ooh, it was finding her in a state where it was life or death, and that's what opened me up. Not more say per se her, but it really let me know the magnitude of the situation.
What you
That it was
feeling?
a little bit more. Yeah. So once I got educated, that was the biggest thing. She had the information. She had the knowledge of what she was going through. I didn't have the education, so I was ignorant to the whole thing. And I don't
Mm-hmm.
think I was in denial. So I want to be clear, because sometimes you're in denial. I was just ignorant to it, like, because I'm thinking you're not struggling. You don't really want for anything. You pretty much, you have a cushy life. The things that most kids worry about, you don't have to worry about. But when it's a mental thing, it doesn't even matter the things that you think she
Mm-hmm.
shouldn't worry about. It's something else. So I had to understand that the anxiety and the depression and the phobias, and those are things that once you can't control, no matter how clear to me it seemed like it shouldn't be an issue, you can't control those things. So I had to go to therapy too with her. So I'm sitting there learning things as
Mm-hmm.
well. So and then I had to educate myself on the mental health community, the doctors, along with other patients, because and this is where I learned the stigma with mental health and the different cultures, whether it be financially, whether it be demographic. It was just a difference in how people are accepted. Having insurance would change the type of treatment you was receiving from certain doctors, and it was just baffling to me.
Mm-hmm.
And I'm sitting there listening to this, and I had this one doctor, and I actually had to intervene, and I had to say to him, I said, "Hey, stop! You're not going to get anywhere with her talking to her that way. You cannot get through to her like that." And so educating yourself
Mm-hmm.
is the biggest thing, and I had to learn the hard way, but I learned. That was the biggest thing, just learning and understanding it. And it's something, I will say that much. But I think sometime what I did learn was some doctors are doing it so often they become numb to it, and every patient is not the same. But because you're seeing the same symptoms, but you're not
Mm-hmm.
seeing the same patient, and I think they carry over residual, you know, patient symptoms and attitudes to each patient. And I think sometimes they get left in that category of, okay, you're another one, and when really they're not. So I learned a lot. I had to learn a lot. It was difficult, but I did. I learned a lot.
I think you bring up something that is really a good point. You know, a therapist, psychiatrist, psychologist, we are not all the same. And um, you need to have what I call a good fit. And if the person and you cannot connect, or you don't feel like they're listening, um, or they just don't have any background to handle what you're doing, you can ask for a referral, or you can just go to somebody else. It's okay. You know, that if you leave there and you're like, I think I just banged my head against the wall for an hour, get somebody else. Don't give up.
Well,
And
and I'm glad
again,
you said that, because we did that. We went to several different doctors, but what we found was
mhm,
ahead of the appointment, they would try to spin it as if, oh, this person is, what's the word looking for? Pill hunting, or what's it called?
right. Yeah.
Um,
Right. They're med seeking. Now they're just
yes,
looking for medicine.
exactly. But it wasn't because of the meds, it was because of the fit. And there was some because of her intelligence level, they felt like there was nothing wrong with her, because she was, when they would do the test they would do, she would rank higher off the charts. Intelligence is not even the issue, but because she was so intelligent,
Right.
they thought that thank you, there you go.
She was manipulative. Right.
Exactly. Yeah.
Right. Often when people come to me and they haven't gone to see a psychiatrist, but I really think they could benefit from medication, um, we sit down and I go over there after we've gotten to that place of say, okay, now when you see the psychiatrist, don't minimize. These are the things you need to tell them. Why? Because that matches what they need to understand what kind of medicine you need. So just because you've kind of unloaded it here with me doesn't mean that you shouldn't tell them that you're having crying jags every day. Oh, but I'm not having in front of other people. But you're crying every day, and that's
But
not within the norm. Or you're
and I'm
having,
glad you. I'm
yeah,
sorry, but I'm glad you brought that up because what we learned, and I think people need to understand the difference between a therapist, a psychiatrist, and the psychologists are different. So when you're going to different doctors without explaining to the patient one why you're sending them there and what to expect from that doctor different than what you're giving them, the education from doctor to doctor is not there. It's not explained. So you again, like you just said, this one patient has unloaded all of this with you, and now you're saying, take what you just gave me, pack it back up, and go unload the same baggage off from somebody else. And then, oh, by the way, take that same luggage and go to somebody else. That patient has lost their patience with that scenario because they're like, how many people do I need to talk to with this same information before I get some help?
right, right. I agree. And when I have patients, clients that are in that situation, it's like, okay, this is why I would send you to a psychiatrist. The psychiatrists are the MDs or a psychiatric nurse practitioner. They can give you medication for these things. And here's why I would recommend medication. So if you've got anxiety, but it's mostly due to some just transition you're going through right now, we may not suggest that. We may be working on just the coping skills to deal with it, to bring your anxiety level down for you to manage it. But if you're having major panic attacks and can't make it out of your house, and it's been going on for a couple of months, I will send you for medicine. I will also explain to you if we have to do testing, what the testing is for and what it's about. And I will send you to a psychologist. And the psychologists are, again, it's kind of like, where do you fit? What are they looking for? So that they can sit down and they give you the testing, and they can determine what's going on. So especially if I'm really a little shaky over diagnoses, I've had people that, are you on the spectrum? Do you have ADHD? Do we have a learning disability in here? I'm going to send you to a psychologist. I'm not going to send you it's a one-way trip. I'm going to be like, and then when you get the results, bring them back, because I know they explain them to you, but they explain it to you at a different level. Bring them back. We'll go over them one by one, and we'll say because I know your background, how we can implement some changes and what it's going to hopefully accomplish for you. It's when I started school, I didn't know the difference either. I mean, I knew a psychiatrist was an MD. Okay, great. But then the rest of us were all just jumbled in there. And technically, I could do testing because we have to practice it, and it's part of my licensure. I'm not into it. I'm not going to do it. But I know how to interpret the tests, and I know how to get it across to people. And sometimes you have to take it in little chunks as to what we're dealing with. So it makes sense to you. It's not just, here's the report and you're going, I don't understand a word of what this says. And okay, we attack the tests. And that's further evidence that I don't know what's going on. Now, I consider that as part of what I do. So will the MD will look at the test, and based on the test and the subsequent diagnoses based on the testing, they will also prescribe medication. But they can prescribe medication based strictly on symptoms that they see, how long they've been there, how your thought processes are. They know to recognize the difference between psychosis and chronic anxiety, generalized anxiety. They know which direction to go with that. that's why we've got to be upfront. And that's why I tell people, we got sleep disruption. We need to let the psychiatrist know that too if we're sending you for medicine. And, so they've become much more specialized. At one time, they also did like psychoanalytic therapy. I haven't met anybody in years who's a psychiatrist. Now they're just doing the medicine part, strictly the medicine part. They see you for 20 minutes to maybe 40 minutes the first time, and a much maybe 15 minutes every time after that. They're not doing any therapy. Some psychologists will, but not going to be included in the testing. So I still can't hear you, Adrian. Still not there. I see her. Okay.
I think she's gonna try to call back.
Yeah. But, I think it's terrifying for most of us that are parents when we're dealing with our own children. And especially when we have our young adults, and in the long run, we can't make the changes for them. We can put them in the right place. We can help to understand the issues that they have, but then we've got to let them pursue it. Obviously, you're going to have some places where it's like, well, there are limits. If my child is suicidal, no, I'm not going to let that happen. But, you've got to understand there's limits on any kind of control we think we have. We don't really have control. Again, if you push it and you start to really lay the hammer down, they just go underground. And you would too. I mean, how do you get along at a job you don't like?
Well, the blessing for me was my daughter she wanted me there. So that was really good. She wanted me at her appointment. She wanted me speaking to the doctor. So whenever she went, I went. So that's the benefit that I had, that I would say that if a parent can make sure that happens, it makes it so much easier for you to understand and know firsthand what's been said and what's done. And then as time went on and things got to our new normal, then I kind of backed off the appointments. And now she does her therapist by herself and do appointments. But she wants to backfill me on everything, what's going on, what the doctor said, did she change medications, did this happen and that happen. So the communication is there and I'm listening and I get it. But that is a benefit that I think that I had, was that she wanted me in those appointments where some parents didn't have that.
Right. And I have some parents that are terrified to be there. I'm still going to work with your child, and you brought them there. And I will try to sometimes pull them in when you can have them initially when you have people less than 18 years old, but they're not going to be in there every time. And a lot of times it is me trying to connect with them and trying to give them information. And their child may not want them to know. Kids kind of forget that we've already done about everything that they've already done. One way or the other, it's not going to be a big surprise. But other than, really, you're doing that? What?
I just wanted to. Can you all hear me now?
Yes.
Excellent. I know. Terrible. I have no idea what happened there. So I apologize to you all and to those listening, because I know it's starting to get late. But I did want to say one thing before we say our parting words here. The medicine, I struggle sometimes with that too. Like, I know it seems like it gets to be younger and younger, and I wonder sometimes are people going to be on medicine for life? All the other things that happen, like, oh, you take this, it has an effect on your kidneys. You take this. Are there more like homeopathic, kind of more natural things that we can do, especially with younger people, so that you're not 12 taking medicine until you're 50? And then the unintentional consequences of now it causes something else to malfunction. Are there other homeopathic, more natural things, instead of just like prescriptions that we try with young people and even adults for that matter?
And it depends who you go to. for the medication. And some will, and there's some homeopathic, psychiatric nurse practitioners, and they'll be like, okay, here's the medication you can use, but you want to try to go as natural as possible. So here's what I would recommend. And I've talked to people about various meds. For instance, for anxiety, L-theanine, which is naturally occurring within you, but when you take that, that is very calming. So, if you've got kids that are anxious, that's one that helps. And it just kind of moderates things. And again, that's for adults too. There's a variety of things that you can take depending on, what's going on. Should you still see a practitioner when you do it? Yes.
Yeah.
Because some of them have impacts on other medicines that you may have to take. And a big one, for instance, that a lot of people use that has been proven scientifically to be helpful for mild to moderate depression is St. John's wort.
Oh,
But
yeah.
St. John's wort can interact with some other meds. So you need to run that by your doctor. And that's one that, okay, where are you going to be at? How's that going to work for you? Understanding that what meds you take for stuff that is short acting, like if somebody's taking a Xanax, they shouldn't be living on them. That is supposed to be for, short acting. I'm having a panic attack, or I'm about to walk into this, horrible situation, and I take, half a Xanax, and it gets me through whatever the situation was. Maybe it's the funeral of a parent or something where I'm so overwhelmed. It just calms me back down. But you should learn the skills that go with that.
Right.
What you do when you have depression and you keep having these major depressive episodes, you're probably going to be on continuously on a medication. Some of the meds are short acting, supposed to be for episodic things. Others are supposed to be long acting, where you need to build up into your system. And that's, when people are taking these medicines, they need to make sure they understand which is which with the doctors, not just taken as prescribed. Tell me, is this one I need to take every day? And when will I start feeling better? Some of the antidepressants, anti-anxiety meds take 4 weeks before you really strongly feel it. You might feel a little bit after the first week, but none of those are instantaneous. They've got to build up in your system. Don't go off of a medication like that cold turkey. And you're liable to have, what it was trying to manage come roaring out of the closet. Wow. And then you're feeling like, what is going on? So, make sure that your med or your supplement, for that matter, are managed. That what am I taking, and report on it, and make sure your doctor has a clue of, you're taking that, or you want to take that. And some of them will even say, well, I don't think it's going to hurt you. I don't know what it's going to do for you, but you can take it if you want. So there's all kinds of things. But if you really want to go homeopathic, take a serious conversation with some of the practitioners that's their focus, is trying to do things homeopathically. They're still licensed people, but be serious and get serious about what you're doing when you take them. If you need to take
I'm
it
hearing you say
consistently,
to Maureen, be open. Be open with what you want, and open with what you're talking to your doctors about, potentially too. Sharing the medicines. Because that's just always something I worry about when you see young people, or, oh, they have ADHD and we put them on this and they're in 5th grade. And I'm like, so are they on that for life? And what are some of those other consequences of being on that? And maybe I'm overthinking it, but I just always wonder about that, especially, talking to so many young people.
There's a
Boy.
lot more research out now on the long-term effects of those meds. And because they're managed really tightly, they help the brain function better. And you're not taking like, hey, just take just take a handful. Those little bitty pieces can really help you stay on task. Do you have to stay in it to get forever? And that's going to be, it really depends on your kind of symptoms. And as you make it through puberty and you get into adulthood, do you still need it that
Right.
way? Do you need a different med? Can you do with no med? Have you managed to develop some really good positive habits while you can stay focused? ADHD, like many other things, is not, do you have it, do you not? But it also can be at, first off, there's many kinds of ADHD, but the
Right.
intensity. And when you have somebody that's on a scale of 1 to 10, they're an 11, they're all over the place, they can't manage, they can't sleep, they're, their motor is constantly running, they're having trouble focusing, they're socially are running into everybody. You can't make those connections. There's a good reasons why some people need to be on the meds, especially when they're kids, because that's when you learn how to communicate with people. It's
Right.
when you learn how to, get into this completing tasks, finishing things. So
Staying
be on it
focused.
forever. It's will always be evaluated. So,
I like that.
and it's important. Yeah. So that's
Well,
one where don't just say no. Say we
yeah.
can try it. It is short acting. It is not one of those long-term meds like you would take and it's going to be in your system forever. It's in and out, usually within 6 to 8 hours. So you manage that. And the doctor
Yeah.
will be checking with you.
Well, thank you, Maureen. This has been awesome. I know it's getting late for some people, but this was such a great conversation. We were very authentic in sharing a lot of good tips. Before we close out, I know we're a little over an hour, but before we close out, are there any departing words that you or Lynetta would like to share in terms of, getting through the holiday season, being open and vulnerable about taboo topics that, we talked about children tonight. We talked about meds. We talked about compartmentalization. We talked about holiday tips, sharing tribe, uh, changing the course of what you listen to and who you talk to in terms of music and relationships to stay positive when you feel like you're drifting into a space that may not necessarily be a place where you want to gain any degree of happiness. We also talked about children, picking the right doctor, and also being safe people for our children to come to us. And then when they can't, accepting that they did at least go to someone else. And if we need therapy as adults, we can do it as individuals with our children and or identify resources for our children. I definitely took away, I'm even more closer drawn to actually talking to someone myself and getting beyond my compartmentalization winning attribute, which I thought made me really productive, which probably is crumbling something else inside. So I thought it was a great discussion, and it's our last chat before the holidays. So I, of course, want everyone to stay happy and healthy, and want to defer to you and Lynetta for any other closing thoughts or comments.
I would really ask people to reach out to folks that that might be alone, that might be struggling with losses.
Good.
And people were like, I'm fine, I'm fine, I'm all by myself. Well, then let me come and just spend a little bit of time with you. Withdrawal and self-isolating is not good. That doesn't mean if you're really feeling like, well, I need to get some sleep, let me sleep. But but really try to reach out and include people that are part of your tribe, that are part of your group, that part of your support system, and bring them in. And it doesn't have to be perfect. It's just like, come on over and watch the game with me, or wrap presents with me, or let's go shopping together. That human connection is what often pulls us out of feeling very anxious or feeling very depressed. And especially if this is a season that strikes you like that. So it's like, just share yourself.
I love that.
It doesn't have to be raw bone, just connect.
Yeah, I love that. Your thoughts, Lynetta? That's good. Because I tell you, loneliness it can be a trigger, right? Being alone by yourself, just your head and everything wandering, your mind going to places that you don't want it to go to. Very true.
No, I think that was a good closing comment she made. And I just want to say thank you for having a space to share, because this is important. Thank you.
Yeah, thank you. I know you're looking at two African American women sharing. Like before, you remember the old adage was keep your business in your
Business in the
household,
house.
right? So that
Right,
if you
right.
went down and told the neighbor your business, there could be consequences. So I love the fact that now we're opening up as a community, and then, embracing diversity of life lessons, because I find we're more common than we are different. So Maureen, Leister, you're amazing. We thank you. I do think you need a TikTok, because you have such a wealth of knowledge and information, and you're so relevant and relatable that anyone at any age, and I see why you see a whole variety of people, can embrace what you have to share. So how can our listeners and our viewers stay connected with you, and get on your calendar, select you as someone to help them get through? Can you share your information?
Let me give you the phone number to my front office. And it's 804-706-1111. And well, we'll fit you in. And if somebody lives nearby, there are some other people that are there that also have clients. They're not
Can you
me, of
repeat that
course,
number,
but
please?
So 804-706-1111.
Thank you. And Colleen Ruffner said, happy holidays, everyone. Monty Harris said, thank you. Great discussion. So we had great positive feedback. So thank you all for listening, taking time out of your schedules. Hopefully you found it very helpful. And now you have a resource. You can reach out to us, Lynetta, myself, or you can reach out to Maureen, the expert, and she'll definitely, like she said, assist you or make sure you get what you need. The idea is, no, you don't have to go it alone. Like I said in my social media post, and that we're stronger together. So be blessed. Have an amazing holiday. Thank you, Karina, for the feedback. She enjoyed the discussions, and happy holiday to you all. Bye-bye. Have a great night.
You too. Good night.